Good morning, viewers. You are welcome to the hospital show, coming to you live from Women of Passion TV. I am Olivia Edupoku, your host for today. I believe your Christmas was a great one, and I pray that 2021 brings us successes and good health. Before we start, if you have any question or suggestion or comments, kindly drop them in the comment box. And please, if you've not yet shared this, just hit on your share button, share with your friends and your loved ones. For the previous weeks, we've been discussing about cancers, the types of cancers that we have, some of the risk factors, the signs and symptoms, and it was really educative and informative. And today we have a very important topic to discuss, and that is the importance of imaging in healthcare delivery. And we are privileged to have in our midst here two health professionals. And before I introduce them to you, let's go for a quick commercial break, and we'll be right back.
If you define it, woman, pretty woman, that perfect woman, we go there by your side. That God-fearing woman, that kind of woman, God, told you that yourself. If you define it, woman, pretty woman, that perfect woman, we go.
Women of Passion TV. Yes, we can.
You are welcome back from this short commercial break. And thank you very much for joining in and for patiently waiting. If you've just joined in and you've not yet shared it, kindly do so. It might help someone out there. Now, I'm introducing our guests to our viewers and to everyone out there. We have Dr. Joseph Adom, who is a medical physicist at the Oncology Directorate of Confanochi Teaching Hospital, and he has worked on so many cancer patients. Doctor, you're welcome.
Thank you.
Yeah. And we have another speaker in the person of Mr. Benedict Appel Ejay. Sorry. He is a sonographer at Confanochi Teaching Hospital and also doubles as chief technician at the Kwame Nkrumah University of Science and Technology, Department of Medical Diagnostics. Mr. Ben, you're also welcome.
Thank you.
Thank you, and we are glad to have you all here.
For sure.
So, we are continuing our discussion. The topic for today is the importance of medical imaging in healthcare delivery. And as you are all health professionals, I believe that you are going to educate us a lot on this.
Sure.
Before we start, we want to know what medical imaging is about. Dr. Adom, please, can you tell us about medical imaging?
Thank you very much. I think it's a topic, and I want to wish our viewers Merry Christmas, a Happy New Year too. We started the new year before we left for the last year. We educated our viewers on cancer, what they should do. Some of them did it, some didn't do it. About the cancer and the management, how they should go and eat well for this Christmas, so that we come back 2021 more energy, disease-free, cancer-free. And I think today we are here again to discuss one of the most important things that we do during treatment, or say a per se you two area near boy area ho ban very important any kwan say to na se kra because the making you say beginning no na sa normal we no nimdie nkwa nim bebre enti na when people go to the hospital they complain normal bebre to me funny pa bebre I say but and because of imaging say you twa photo apa ayarehwe mu nti no ama say no ama ayarehwe no yetumi call to the extent of knowing exactly where the disease is baby ayare no wan kasa na yekohu de yare ne ba yekohu de akwa kodru yekohu say the be ya the type of treatment e de be man will be on point enti say the kind of medical imaging is very important and it has come to stay because of technological advancement enti everywhere you go in the world everything is about imaging but it's quite unfortunate say when it comes to the sub-Saharan Africa and the Africa and Ghana sometimes it's difficult for people to even afford an imaging and it is sad but at the end of the day you need to do. I remember one of our tumor board meetings and a patient was told to go and take X-ray, CT scan. I think we shall talk about that. Now, otenefia bosome obaines mama na di bosome o se minyeska that we have to go for another modality. Okay, you could try X-ray 20 CD score they could try X-ray kro wani bi. But you know, at the end of the day, the can you say without imaging in this current dispensation, treatment is difficult. Diagnosis is difficult. And you know, say the medical kind say the work it's important for us to discuss about medical imaging so that we'll be able to know our way forward, how treatment will go when somebody is sick.
Thank you very much, Mr. Ben. Please, anything to add to it?
Oh, to add just a little to it, medical imaging is now the forefront of healthcare. Because if you are not able to image the pathology to find out exactly what is going on, there's no way that we can do any form of treatment. And now we are in the dispensation where the practice is evidence-based. If you are treating someone for cancer, you are going to do a surgery. What is the evidence? What shows that there's something wrong that needs to be surgically removed or something that is amiss that needs to be surgically repaired? If you don't do imaging, you are not going to find out. When you watch movies, Superman can look through the human body and see everything that's going on. But with our naked eyes, we can't do that. Yeah. So you need to go ahead to do imaging, all the various forms of imaging, so that you know exactly what is going on and know the appropriate treatment to give to the person.
Thank you very much. So let's look at some of the modalities that can be used to diagnose conditions.
Okay. So when we talk about the modalities, there are two main categories. We have the radiation-based technologies and then the non-radiation-based technologies. When we talk about radiation-based, we talk about the modalities that use what we call ionizing radiation. That's talk about the X-ray, the CT, the fluoroscopy. Those use ionizing radiation. Then we talk about the non-radiation-based. That's when we talk about ultrasound. And then we talk about magnetic resonance imaging. These two don't use any form of radiation. MRI uses magnetic waves, whereas ultrasound uses high velocity ultrasound, high speed sound waves to produce images for medical diagnostics.
Okay, thank you very much. Dr. Adam.
Yeah, to add to what he said, I think we have something we call nuclear medicine. The nuclear medicine too, we have the SPECT, we have the PET. All these things are used to treat cancer patients. Sometimes when you go to the nuclear medicine, these ones, they use it to diagnose and use it to treat the patient. So these modalities are also there. And they are all using, as he said, ionizing radiation. Now when it comes to imaging, we call something EEG, electroencephalography. That one is used to check the brain, the activities of the brain. We have the ECG for the heart movements.
They are all imaging techniques.
Signal. They are all imaging techniques. So before now, said now, before say hospital, first people were wrongly diagnosed.
Yeah.
But now because of imaging, and now before somebody will even put you on a bench, a couch to be operated upon, you have to make sure imaging is done. It has to be done. Now first to say this, I didn't know be imaging. So that at the end of the day, as he said, it's evidence based Now it's about what you see, it's what you tackle. And yeah, so that's why it is prudent for us to sit here and talk about imaging, because it is the order of the day. So as he said, all these image modalities that he talked about, look at it, we have so many of them. So in the absence of all these things, so you ask yourself, in the olden days where they were not having these images, well, so it's important. So we have the ionizing as non-ionizing, as he said. So I think it's important for us to talk about the imaging.
Okay, thank you very much. Mr. Ben, why would a doctor ask you to take any form of imaging?
Okay, so like I said initially, now everything is evidence-based. So you come with a complaint, the doctor has to know exactly what is going on. If you come complaining of pain in your abdomen, you have to do imaging, because that's the only way the doctor can see into your body, because technically imaging is a view into the human body. So once you do the imaging, the doctor is able to assess whatever findings there are to know exactly what is going on. Sometimes the doctor might clinically examine you and feel like, oh, I'm touching something here that shouldn't be there. So once you do the imaging, the doctor then knows exactly what it is, whether it's a solid mass, whether it's a cystic mass, whether it's cancerous or whether it's not cancerous. So the doctor knows exactly how to go about the management. So once the doctor is sitting in the consulting room, they have suspicions. You come with your complaint, they have suspicions. And upon those suspicions, they request for imaging so that they know exactly what is going on and know the appropriate treatment to give you as well.
Thank you very much. Dr. Adam.
Let me add to what he just said. It's very important because, you know, let's take a typical scenario, a patient having appendicitis. You come to the hospital. There has been some, recently, a friend of my mother died of appendicitis, complaining of stomach ache, severe stomach ache. Like no matter what it does, the thing is there. So what happens? You went to the consulting, you went to the A&E, all the doctors working around, then one suspected, no, this is appendicitis. It could be appendicitis. First of all, when they can't suspect it, say appendicitis. Now, appendicitis has a history. Say one way, a rupture, then the person will die. So you have a shorter time to think through what to do next. Whether you are taking the patient to the theater, or you are going to wait for the patient to stay there and wait for the imaging. So in this case, I remember this woman's case. One just died. The lady's mother, he died because by the time they took the imaging, it was too late. The doctor had a suspicion that this could be. But there's another woman I know recently, two of them, but this woman has survived because when the doctor came, we were just waiting at the theater. Confirm my suspicion for me. Confirm. The moment the ultrasound was taken, you saw that he had already made the preparation for that. So with that imaging, you have a suspicion, all right. But still, it's not complete because you can't go and open. You open and it's not what you suspected.
Yeah.
So what do you do? How do you explain yourself?
That's it.
Yeah.
So sometimes, because I remember there was a patient who came from Obuasi. The doctor had, it was a gynecological problem. You know what she did? The doctor opened. He saw that, no, this is not what I was thinking it was.
Without the imaging.
You have to close it. So now I ask myself, did he really do imaging? Did he do due diligence to what he was doing? So me beside my man said, "Mommy, who could try a photo? See me you." So it means that the doctor, based on his intuition and his suspicion to do that. So that's why it's important. Like a doctor, even having known that this could be this, he still wants you to go ahead to confirm. So that's the importance of the imaging that we are talking about today.
Okay, thank you very much, Dr. Adam. Let me put this one across. Since you work in the cancer unit and in treating of cancer, in the treatment of cancer, what are some of the types of imaging required for the management?
See, cancer is a multidisciplinary team. Like when you want to treat cancer, you have to do so many of them. Like assuming, I remember I always refer cases to my senior here, my boy. I always tell him, because when you see a patient, a young lady, coming with a breast problem, you wouldn't allow the person, your image modality said your kind ionizing and non-ionizing. You will suspect, okay, then you could try ultrasound because for a young woman, you think that one person will be introduced to radiation. So we do ultrasound. So we have some baseline imaging that you have to do no matter what. When you go from cancer, from breast cancer, cervical cancer, prostate cancer, lung cancer, liver cancer, lymphomas, sarcomas, myomas, all these cancers, you need imaging. So we do CT scan, we do ultrasound, we do MRI. Sometimes we fuse them together, one imaging, one another imaging. We fuse them because we want to see it well. Because when the thing is about the stomach, you can't tell the person that go and do CT. So I think we will get there. But in terms of cancer treatment, before you can even start your treatment and say that I'm treating this gastric cancer, that's stomach cancer, you have to do all your imaging and get exactly where the cancer is. Because you see, when you have a stomach like this, there are so many organs in there. So you can't just go there and put a radiation in there. You have to do an imaging to limit yourself to exact place where you want to treat. So in management of cancer, we do the echo, we do the ECG. Sometimes you want to know the patient condition. So
that's expensive.
It's expensive, but that is the order of the day now. You can't help it. Sometimes it takes time for a patient to get money to pay all these stuff. But as we said, you can't go blindly. You just have to do the imaging. So in terms of cancer treatment, we go through so many imaging modalities. Yeah.
Thank you very much. Mr. Ben, since you're a sonographer, I'll push this question to you.
Sure.
When it comes to women, what role does ultrasound play in their well-being?
Okay, so when it comes to women, ultrasound plays a very massive role. When you talk about ultrasound, when you take ultrasound and then women, people are of the view that it's just about pregnancy. But then ultrasound is not limited to just pregnancy. We can do ocular ultrasound, that's ultrasound of the eye. We can do ultrasound of the thyroid, ultrasound of the parathyroid. Like almost every part of the body, we can do an ultrasound for. When it comes to women specifically, you know that women have a lot of gynecologic issues, and then when it comes to pregnancy too, sometimes they have issues there. And then, like my brother already mentioned, when it comes to breast issues, women also need to take ultrasound to help diagnose their breast cases and then help in management as well. Aside that, generally, for both men and women, we can have abdominal ultrasounds to check out the liver, the spleen, generally the abdominal organs, and even the bowel. So ultrasound has so many sub areas. When we talk about ultrasound in women specifically, it's not just about pregnancy.
Okay. Okay, so how many times does the woman have to take an ultrasound before when she's pregnant?
Okay, so barring any unforeseen circumstances or any underlying conditions, let's say the woman is not hypertensive, the woman doesn't have diabetes, specifically you'll be expected to take about 3 ultrasounds. So the first ultrasound you take will be in the first trimester, that's the first 3 months of pregnancy. That ultrasound tells us the location of the pregnancy, whether it's properly located, because there's something called an ectopic pregnancy, where the pregnancy is formed all right, but it's not within the uterus where it's supposed to be. It can be within the abdomen. There are rare instances where someone can be pregnant, but the pregnancy is actually in the person's liver. That's a very rare instance. So you can do an ultrasound in the first trimester, that's the first 3 months, to make sure that the pregnancy is in the good place. Then the next ultrasound you do, that will be between 18 to 24 weeks. That's what we call the anomaly scan, where we check out for fetal anomalies. When you talk about fetal anomalies, as the word implies, anomalous, something that is not how it's supposed to be.
Yeah.
Okay, so there are instances where people are born, one eye is not working, the person is born with one hand, the person is born without limbs and all that. Or the person, the commonest type that we hear being talked about a lot is what we call the hole in heart or a septal defect. All these things can be picked up during the anomaly scan. So during the anomaly scan, the sonographer carefully examines every part of the baby to make sure that everything is properly formed, all the bones are the right length and all that. Then after that, You take the growth monitoring scan. That will be in the 3rd trimester. That's after 28 weeks. You do that one to assess the fetal weight, the presentation, and then the amount of fluid around the baby. This will help the clinician or your obstetrician decide how you are going to be delivered. If the head is down or it's not cephalic presentation, it's going to affect your delivery. It means they'll either have to section you or give you more time or try to change the baby's position so that it can deliver vaginally, that's through your vagina. Otherwise, it means they have to operate on you. They also have to check the location of the placenta to make sure that it's not blocking the path of the baby. That will also affect management. And then lastly, the weight. If the baby is too big, there's no way you can push and push and push, the baby won't come. But once you do an ultrasound and it gives the clinician a fair idea of the weight of the baby, you are able to go on then to plan how to deliver you safely so that you don't have any adverse effects. So these are the 3 main ultrasounds that a person without any condition, a normal person, will have to undergo. But when you have issues like diabetes, there's an issue with sugar control, and that's passed on to the fetus or to the baby. So it makes the baby grow very fast. Growing very fast means you are going to have a very big baby. So when you have diabetes, you have to do more scans in the 3rd trimester, 2nd and 3rd trimester, to make sure that the baby is not too big. If the baby gets too big, you might not even get to your specific time of delivery, and they'll have to take the baby out. Otherwise, the baby won't be able to come out. Also, when you have diabetes, it predisposes the fetus to some anomalies, especially anomalies of the neural tube, that's the brain and then the spine, and then anomalies of the heart. So when someone is known to have diabetes, specifically when you are doing the anomaly scan, those are the key areas that you are looking at. The neural tube, that's the brain and the spine, and then the heart, to make sure that there are no anomalies there or there's nothing wrong with the heart. Then when someone has hypertension, it also affects the baby. Whereas diabetes will cause the baby to grow quick, hypertension will cause the growth of the baby to slow down. You get it? So hypertension reduces the growth rates of the baby. So once someone is known to have hypertension, you need to be constantly monitoring the baby. Not just the baby, but then the mother as well. Because the baby and the mother are connected to what we call the placenta. If the mother has hypertension, it has an effect on the placenta. The placenta is what filters out the blood that's going from the mother to the baby. So if there's an issue with the placenta, it means the baby is not going to get enough blood.
Yeah.
All the nutrients are going to be stuck on the maternal side, and then they are not going to be able to be passed on to the baby. So the baby is not able to grow as expected. So you need to check the placenta also using what we call Doppler to check the function of the placenta, making sure that it's working properly, and then assess the growth of the baby as well. So whilst you are doing this, when it gets to a time that you realize that the placenta is not working properly, then it means you have to intervene. So you have to be monitoring them, sometimes depending on the severity. Someone who has hypertension, which can develop into another condition known as preeclampsia, you have to be doing the ultrasounds probably weekly. For some, depending on the severity, every 2 days. So if there's an underlying condition, the number of ultrasounds that you do will be affected by the condition, depending on the condition. But if there's no underlying condition, you don't have any chronic illness, then the base number of ultrasounds that you'll be required to do will be 3. Sometimes a doctor will just add another one at the very tail end of the pregnancy, around 38 or even 40 weeks, to be sure about the presentation, the location of the placenta and all, to help them plan the delivery. So that's a summary of the ultrasound that you need.
Thank you very much. Dr. Adum, before I come to you, viewers, let's go for a very quick commercial break. We will be right back. Stay tuned.
We are women of passion, Accra chapter. Yes, we can.
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 Men of passion.
Yes, we can.
Yes, we can.
Men of passion. Yes, we can. Yes, we can. Women of passion. Yes, we can.
Women of passion.
Women of Passion TV. Yes, we can.
name is Akia Inshiwadeofe, and I welcome you to Strong Women of Passion International. We are an NGO, and our core objective is to empower women by educating and sponsoring in skills, by sharing our ideas and stories to motivate them to be who they want to be. We have members all over Ghana and abroad. Because of that, we have divided our members into chapters based on the regions they are in. We have the Ashanti Region chapter, the Greater Accra Region chapter, the Central Region chapter, the Eastern Region chapter, the Northern Regions chapter, and the Volta Region chapter. We welcome new members, both young and old, to be a part of us. To be a member, you need an amount of 5 Ghana cedis for registration, and a membership book will be given to you. You need to buy 2 t-shirts at a cost of 25 Ghana cedis each. Plus, our monthly dues is 10 Ghana cedis, and we meet on the last Sunday of every month.
Women of passion, we rise by lifting others. Women of passion, yes we can.
Viewers, you are once again welcome back from this short commercial break. Kindly subscribe to our YouTube channel if you have not done it. Give us a like. If you have any comments, any question or suggestion, you can drop them. And if you've not shared this program too, please kindly do so. Dr. Adam, so when a woman comes to your center and she's pregnant, and we all know that and across area from they are very sensitive to these radiations that you give to them. So would you advise that the woman goes for a CT or an ultrasound, or it depends on the case that she brings?
Thank you very much. I think said a big kind start here a kind you say if it be ionizing radiation and non-ionizing radiation when it comes to image modalities. Now in our center basically we deal with ionizing radiation from a sana my boss there be okano and se oko x-ray krana se baby you twa photo no na se x-ray aboko ne dia aboko se onyima mema ho okay etino it means say yes center ho se wonyim na ba I've seen so many cases. There was a woman, a young lady, who had breast cancer. Even the breast cancer, barring the external radiation therapy, the chemotherapy is also cytotoxic. And you see your poisonous. Like the baby can't deal with it. So what we do is that the woman was given the option that se say you so we are say na edu oni wo kunu kwadwen ho akola no sua enti ye pese ye abort patient akola no na ye hwe wo treatment no because awonyima e ba say free bibi hormones be estrogens e kosro e increase the cancer no so growth no so there was this woman he came was akola no kunu so dabi me bani de dabi ni owu and I don't know, excuse me for my words, he wasn't wise enough. As I was saying the other time, hey, oh, ye bema no aware foforo. Or go ahead and ye, or ye no, we no na crown like the condition I was in. Last time I saw the guy walking around with the baby, or no bath for now. He's dead and gone. That's what I was saying. He said sometimes some of this decision lies on you, the person having the condition. So my center, there was another instant. There was this lady. Not our throat cancer. It was like a throat cancer. It was supposed to treat using radiation. This one is radiation. Then we looked at the age, the month of the baby. We realized that okay, when we go by radiation, the child will be affected. So what we did was that we tried to shield the baby. So we looked at where we were going to treat, and as I was saying the last time, we are using radiation to treat the patient, all right. But at the end of the day, we confine our dose to the exact location where the disease is. So we're looking at the distance from where the disease is. So this is the truth. So we're coming to the stomach. So we wanted to block here the stomach. and measure the amount of radiation. So we did something we call we put in phantom there, we did all these measurements, and we realized that no. Looking at the time of the baby, like the age, what should I put it? Is it the
gestational age?
You can't just continue with the radiation. The baby will be affected. So we stopped. Fortunately for that lady, when further investigations were done, we realized that it was not cancerous. So if we had gone ahead to treat that patient, you see what would have happened. So in my center and even in every imaging is very important. The first question a doctor will ask you before you ask you whether you are pregnant. And sometimes you can go ahead to do some of the imaging, looking at the age, the time of your pregnancy. Sometimes you think that in the first trimester, I know they are very, very vulnerable. You can't just do imaging. But at a later stage, you can measure the amount of radiation X-ray can give. And you think, with the baby, can the baby take them? So you do that. Just because, so it's very important. Every woman who comes to oncology department, who is supposed to undergo radiotherapy, very important, because we are using high energy radiation. So we ask, and we look at the gestation period and look at all these things, and before imaging will be done. Now we've had a patient who's supposed to do CT because we want to treat the breast, but now patients I feel now wow. So all we told her, they said, "Any more money banning no from like." So these are some of the questions you ask to know what the patient, because without that, you have to be truthful. We are ban alcohol hospital. Yeah, so it's important. Yeah.
Okay. Thank you very much, Mr. Ben. If I say Obanyam, not say Oba Ohonum, say Obicha ultrasound. Ebi Ohonoma, how long does it take? And some among them say Ebi Akadegi or Yoba, and as well your Bema. And at the end, the moment in the day, sir.
Oh, okay. There will be who say Oya Oba na Bema. It's the same thing I me who say Oba, and the same time I'm who say me Bema. In the 90 ma. So a Bema, you be who the Bema, so your band, so you be who dia, a ma one. Usually, around 5 months, 5 to 6 months, and the ideal time, yadeke. So, ocean in term do and can we who ye, and I am maybe more, will be our catcher say, you catch him say, me banny say, but me call you no assistant, and I'm away an assistant, patcho, and sister. Now I said, your share, no, anyway, who ye. There is no way I nyango pondi ebe mobi say oye oba na later on was san adwen say dey be pesa oye bema dey be insisa nti say one share no correct time na na unhu ni ye na say esisa pa de ensisa nti between 5 to 6 months that's a proper time o sha obehu bibia yi ba esangina say na akola no eda ho si ye hwe na akola no butu ho ana waka ne nan abo ho a enya ade a obehu nti o say o ma ho time nti da wa ya ta so say obehu no pa no your exercise a ebe mu aye me ho say obi ba say we hu eno a onko na de o say o nanti say na be ya akola no be da ne obekeka ne ho wa asesa ne position no ten the manifold steps koba first one still na akola ne da ne ho no sanko obi o koba na afa akola na da ne ho because enkola babies no wo shey free ma once woda ndi se ba set time na opese ye hwe ma no wada bibie hu abetumi agi nyane no da be ya be nyane no se wo be active wo ye active a ekeka na obeda ne ho na yetumi ehu dia ope no ama
Okay. Dr. Adam, please so in your center in cancer management, Amayamun said imaging is very important, but there are some situations that patients need to know. Maybe I okay so onkocha image na sana waba oboka ko difference maybe is due to maybe as kasam I wire then sana almost about doesn't it have any effect on the treatment?
Thank you very much. I think said as you said last time, say I can't cancer one same degree. But before I continue, I'm say me person me deep question back to Muma, sonographer. He was talking about seeing a hole in heart during the abnormal scan. We still have so many children with hole in heart condition. So I would like to know, when does it come? Does it mean say, oh man, yet that scan no ana, but minimobia or a scan no yina, but you know, the banner bar, not that no himself any binya, but that was a condition that the baby presented, like came with. So I want to know, is it because you don't see it? And now say, sometimes it's doubtful, because for the first time, because I was thinking that abnormal scan will be taken, fine. But now me to me like you can go to that extent of So how does that happen?
Okay. When it comes to specifically hole in heart, no, the instances are bit me a messy. It can easily be missed. Many cardiologists back home, in my practice, I realize there are a lot of babies being born with hole in heart, but what's your my anomaly scan? So what was the issue? One thing that came up, they say, baby, I work with child scan. Nipa na na no no professional. Nti also wire scan na dey bibia normal, and so protocols are also follow to make diagnosis no. When follow protocol because only ya normal wire 6 months then 6 weeks training near there wo fe wo sonographers no. Kumasi ha bebre wa ha enya ha nkwa Ghana ha ni na nipa wo hosa. They don't know the protocols to follow to come out with a diagnosis. The other thing so they say hole in heart, sometimes it can be so small, and the heart is the only organ in the body that's in constant motion. Like kind of is the only protocols I'll be follow, angles I'll be use to know who ye say oh they be to daha, and I say quite be daha as I said daha na you can easily miss it. Because akumana and no say air bossa age na mouse say we na we are not was there be. Akumana tem bia ebo nti with that no it's something that can easily be missed and all yin so na e kese so say na me kan anomaly scan is between 18 to 24 weeks nti 18 weeks honum no why anomaly scan na ewie no ebisma base na e kitikiti ba akumana e kese no na no so e kese akumana e kese na tokro na ba be dem no holy heart no na no so e kese till say obewo no but what happens also a lot they say once a wire anomaly scan na ewie no oba betwa follow up scanner bakuna oye no on check for anomaly bio because waka check say wire anomaly scan na ewie and na bibia normal into on here follow up and say oh probably na bibi wo kwa ye hu anansi bibia. That's one other thing I would advise my colleagues ne we use ultrasound na say it's something that should be continuous. Even though it's a wire anomaly scan, there's some main structures there, and they are also making sure so over see a problem you or once you beat me because hole in heart is developmental, it's continuous. In this anomaly scan, we who cry, no, the very last scan no cry, beat me. I can say, oh, they be hole in heart for honor. So the professional aspect is a very key part in the management and the diagnosis even of hole in heart.
Okay. So it means say the okay nyina say the na me pese adofo ne ahwefo a omohwe nyina say you just get up and go and do imaging
anywhere.
Yes, so fiti wa ye tro esue ma wa ye tro ultrasound ma wa
baby keke
there are professionals out there who do it because at the end of the day, as you said, management of your disease is now evidence based.
Yeah.
The ultrasound, reporter, sonographer, and better man, and then a doctor, because there have been instances doctor will disagree with what is written because clinically, what he sees is different from what the person has written. There has been instance. There is this gynecologist at Konfanochi. There was a cervical cancer patient. Per clinical observation, when he opened, you saw that no, this is cancerous. This is this. But even that one is not even me. Pathology came, giving a different report. So there was a misunderstanding. But not misunderstanding, but you see, he still wanted to. So giving you an imaging to go and take an X-ray, to go and take an ultrasound. You don't just get up and go anywhere. Go to the right people. Go to the right places so that you get a qualified sonographer, a qualified radiographer, so that you take the image, no amount better report. Back to your question. Mimi center like cancer, seminar near cancer, cancer it grows. So, obi owa otuminya breast cancer. Nye breast cancer ne bekuno. Obenya lung ne bekuno. Liver ne bekuno. Otuminya cord compression, spinal cord na kokan. But cancer na enante. Enti ebia unya cervical cancer. After doing all the baseline investigations, you say okay, a stage 1A cancer, because the cancer, cervical cancer, as it, depending on where it has reached in the service, and the baby who stage are edu, or what in a few. So by the time of back now, maybe it has moved from the stage 1 to say 3B, and it's very aggressive, especially when we talk about the lymphomas. Oma, I know more bua ne bone konwa. Obua ye kotwa image na mana for treatment na. Ye be a friend mask. It's an immobilizing device. Ye the show kon say the beya ye person better any uti. We stable. Obi ha wo ye mask na mana na ade na ehye no ho ye be say. One man image so onko no nkotwa CT no mra no. Obeba no na ade na ye kakraka. Because when yeska the thing has advanced, and cancer, as we said the other time, early detection saves life. Early detection with better treatment, qualified treatment, will save you. So the fact that you detected early does not mean that you are cured. You have to go to the hospital, continue with the treatment, because the modality, like when you come to cancer management, one step, because breast cancer, for instance. You do surgery, you do radiotherapy, you do chemotherapy, you do hormonal therapy. All these 4 stages, you can't avoid any of them. So assuming you skip the other one, sometimes obi o ha o twa no for no we na wo panye ni we a me ho atome on baby. But still we need to go ahead to do the radiotherapy. See, you know, imaging is very important at the stage obeba no na ye kase koya, but said ye kind sikasem ti na ne bon so eden kakra enti sikasem ti no obi a onya wanya sa pe e basa obeba no na ne yare na kwa animu enti de yesre nyina ne say education e de mamafo nyina ne say now the imaging is the order of the day. No matter what. Me boss be ka kire say mame say ne want me ama me ankoye side we ama e betom re bi no wodi yare we na be sa ba bi wa at advanced stage and you obi twa kofa wiase sika nyina ba ma ye tumi jonkwa. It means that when we detect it, we need prompt response, prompt treatment. Enti the ye kan nyina ne say imaging no sometimes enye ye fe kwa adana me ka kire obi say me tue pa makatua na me o me ma ni bia oto no, because imaging na nkasa na nye treatment. Imaging ni ye de hwehwe say ehe fa say na adru say na me maame bosumi bia say nkotwa ebia CT scan 1004 14 million timiti free me salary man say na kan. So it's not easy at all, but enya basa aba then obey. So what we are saying is that for treatment to be effective, imaging had to be done, and said the mebra kind ultrasound, CT scan, because you perceive bone, what is happening in the bone. Sometimes depending on the what we want to see will tell us the kind of imaging that you should go. So like many cases, for instance, when we want to treat the pelvic area like the prostate cancer, we'll tell you to go for CT scan. Okay. Now if you want to treat, like as he said, we want to check say in the breast in the baby, say okay, call mammogram, because we know say mammogram no betumi yi say abaki to e bi kwa wo nufu no ma e betumi enti no the imaging na nkasa no, depending on what is wrong with you, will determine what kind of imaging that you are going to go through. It's maybe how a prompt response, prompt imaging, prompt treatment, then you get treatment.
Okay, Mr. Ben, my last question for the day. In case a woman comes to your center and you find out that there is a hole in the baby's heart, do you do anything to correct for it, or you have to wait for the woman to deliver before you operate on the baby?
Okay, so Ghana had there isn't much we can do. We have to wait for the baby to come out. And even with that, no cry, or banner, or see a train money in Kakra, and son, I eat my operation a man. If you who said baby no holding hearts now, the Abayana say, your better reports now, now that coach or doctor. Now, doctor, I'm out with Futubia or Hobia. Now, Kolani in Kakra, or makes me repair no, amano. In other countries, no, I know say they can do fetal surgeries. In the end, they are Kolani say if na what the instruments a really na oma repair defect no, and I took no what the idea is to no. But Ghana had the nimdenye ndu sa. Nti had the ajo owa Kolani we na onyin kakransa na yaye repair no aman. And the nam TV su be holding hands with his car. E ade a esikasem. Esikasem. Ebi mo ha won tumi na wodi o ma ya ade enyin. Nti akola nyin kakra na yaye operation aman near repair.
Okay, thank you very much. Viewers, we're coming to the end of our discussion today. But before we do that, Dr. Adam, any take-home message for our viewers?
Thank you. Imaging is the order of the day. And in this current dispensation, treatment is evidence-based, and we need an imaging to be able to come out with better treatment. So the catcher nipenina say sometimes when me yamon sheye see a hospital, the kasi kucha X-ray, the kasi kucha ultrasound, the kasi kucha CT, the kasi kucha MRI. Man yamon sheye no, but the doctor ne person ye nyina ne say o se nyina ye boa said the beya the yare no e binya anopoma sibre said the beya e bitumi ama better treatment. Ni ehun ba bia yare no wo pa yi the etumi better treatment. Enti no the meka nyina ne say eya omomboa oma omohwe yare no said the beya omoso bitumi aboa omo, and in so doing we all come to a point that you bring better treatment.
Thank you very much, Mr. Ben. Any take-home message for our viewers?
Okay, for me, my take-home message will be that say your mouth crata say kucha scan, kucha X-ray, and as baby say baby out there con nipa or hono, or qualified, or professional, or license, or the age man, and sana or the alcohol. And sir, some more better. Say I mean you have my kind. The ever throw paper na so and on the so e ya hwe ehun yare asa yare ndi say otron kwase asem say otron kwase asem a eno aso me begina e de ahwe a emba obia nti yan hwe say tem bia no yare be call baby a you qualified professionals e ho say na be ya ye benya ya hoto ne ayare sa.
Thank you very much. Thank you, Dr. Adam and Mr. Ben. We know you are very busy, yet you took time out of your busy schedules to come and educate us. We are very grateful, and God bless you. And to the founder of Men of Passion, Manana Sewa Oredu, God bless you wherever you are for making this dream a reality. God willing, next week, viewers, we are meeting same time at 10 o'clock a.m. on Women of Passion TV. I wish you all a great weekend. Bye.